beauty.
Okay. Usually because it's a woman's dream, you know, to have this kind of nice breast, and of course not only having nice breast but rather wearing that nice clothes, sexy. Kasi minsan most of the patients complain that regardless of how sexy you are, you have a very nice body, but the breast is really small, and they cannot even wear the, you know, of course they want to show some cleavage, and for them to become attractive.
And yun yung tinatawag din natin the enhancing the body curvature.
Okay.
Yeah,
It's part of the body. So let's talk about body curvature. There's a lot of treatment right now, surgical and non-surgical treatment for body curvature or body contouring. What's the best and what's the most common treatment for body curvature, Dr. Dalisay?
Of course, syempre, dapat hindi muna natin makakalimutan yung proper diet and exercise, ano? Pero if ever yung pasyente naramdaman nila na meron talaga silang mga stubborn fats, mga talagang kahit na sobra na silang nahihirapan, maraming time para sa gym.
Even though nag-exercise sila in diet, there's what you call
sometimes may mga areas talaga na napak-stubborn nun. So, we could address that problem by liposuction. So, in our group practice, we do traditional liposuction. Ito yung familiar na yung mga tao na yung ginagamit tayong cannula to suck the fats. But now we also use the plasma liposuction.
Plasma liposuction. So, what is plasma liposuction? And I have heard all about this. And they said you don't need like, there's almost zero bleeding, and you can go home immediately after the procedures. Dr. Fulgado?
Most of the procedures naman, lalo na rin sa body contouring na tinatawag natin, the patient always, they can go home right after the procedure kasi outpatient nga, no? Ito yung tulad na sinabi mo, yung plasma lipo, ito, we use light and literally we melt the fats using light din sa loob ng ano. So, maganda rin to kasi combination, yung plasma lipo and traditional liposuction using syringe and yung mga machines. So, yun yung gaining popularity ngayon, yung trend, yung plasma lipo. Kasi, if plasma lipo alone ang gagamitin natin, parang borderline ano siya non-surgical, surgical eh. Kasi you don't use yung knife para mag-cut, just a puncture lang ng needle, yun lang gagamitin natin, kasya na yung cannula. So, relatively safe and less ang scarring.
Oh, that's nice.
And of course, aside from the mga surgical procedures, yung mga non-surgical available din for body contouring, like mesotherapy, more radiofrequency, cavitation.
When you say the newest is cavitation radiofrequency, how does this work for a patient? Let's say there's a lot of several I could say beauty regimen or body contouring regimen, and I could say one of the most popular and new in the market is we call the cavitation and radio frequency or RF. How does this work on the body? Even do you need to be hospitalized when you undergo RF cavitation? And how long is the procedure?
Yeah, so ulitin natin, no? We have lipocavitation, radio frequency, meron tripolar and bipolar. At saka yung, actually meron pa nga cold therapy. Well, dito kasi sa atin sa Philippines, mas sumisikat ngayon yung lipocavitation and RF. So you can do this mga parang lunchtime procedure na rin. Kasi 1 hour
when you say lunchtime procedure, you can go to the clinic during lunch break, and then you can have the
you can go back to your work.
Okay.
As if nothing happened.
Yeah. Really?
It's like parang nagpapamasahe ka lang doon sa area na, and it's a little bit warm, kaya relaxing din yung pakiramdam.
And yun din ang talagang feeling mo, yung para ka lang talaga nagpapamasahe. Kasi relax na matutulog ka.
You do some centimeters or inches after the procedure?
Right after the procedure,
so
you would notice some.
Are you measuring it before the procedure and you're measuring it
Yeah,
after?
we have before and after measurement.
I see.
We really measure before the procedure so the patient can see, appreciate kung ilang centimeters. And usually nakakabawas ka talaga ng 2 centimeter at minsan hanggang 4 centimeter pa eh.
And it involves not only for the fats, but it tightens the skin also.
Again, we have before anything else, we have a texter from 0917-724-0949. It's good morning. Just watch GNN. just want to inquire regarding facial whitening. You see, my face seems sunburned. Siguro na sunburned siya. And now, nagkaroon ng pigmentation. I tried several products and avail several peeling of cream. You have an outlet here in Zamboanga. So, probably this patient is having this, na sunburned siya. Then the patient had a hyperpigmentation after. And she tried several regimens and it doesn't work. So,
it would be better for you to see your doctor first before you apply anything.
Correct. And
So-
probably you can apply maybe, you have to really consult a physician, especially with this kind of problem. Sometimes the more you apply products, the more it gets worse, no? Ito, again, we have another texter from 0933-184-9805. Do you also treat keloids? Before anything else, what is keloids? I mean, what does it cause?
Well, yung keloids kasi, nakukuha yan sa lahi, genetics,
Yeah,
ano.
genetics. There's some
And then,
people
may mga areas kasi sa katawan natin na prone talaga sa keloids, especially dito sa trunk, lalo na sa likod natin, sa dibdib.
Right.
Ito yung mga prone to scar, what do you call this? Keloid formation. But we could address that problem. Sometimes we just do steroid injection, baka ano tayo ng steroid or cannulum injection para ma-suppress lang yun. But we cannot revise it. Kasi pagka ni-revise natin yan, once na hiniwa natin, tinanggal natin, there's a possibility, higher possibility na babalik na lang din yung problem.
Wow. Well, doctors, we have a lot of texters. Inuulan po tayo ng mga texters. And maybe later on, we will answer all those texts. And for our televiewers, please indicate your name and location so we can answer your questions. And you can text us at 0922-891-6761. And we will be discussing several texters. So when WhatsApp Doc returns.
Our hands and say how we feel much better every time we were together. When you are so alone, my heart is where you'll be when you go.
Yes, and we're back here in What's Up Doc, and we have two prominent cosmetic surgeons of the Philippines, of course, Dr. Wayne FULGADO and Dr. Ken DALISAY. And then we have a lot of hanging questions, doctors, and I know that you are one of the most reliable cosmetic surgeons in the Philippines. And Dr. DALISAY, okay, now there's a lot of patients asking about a whitening thing, you know, we call it glutathione. It's very popular right now. Ano ba talaga? What is really glutathione? Is it really created for skin lightening? Or what's your opinion regarding that? I know I've watched you in one of the prominent news TV shows here in the Philippines. You were there. You were talking about your opinion regarding that.
Yes, I was at about the same thing.
You are the resource person. Okay. Dr.
Well, about glutathione, there is what we call endogenous glutathione. So, meron na talaga tayo sa katawan natin
that means that
na glutathione.
Okay.
Kaya nga lang, ginawa nila yon dahil nakita nila na yung mga healthy people o yung mga tinatawag natin na centenarian, mga more than 100 years old, ito yung mga tao na matataas ang glutathione.
Oh, okay.
And this glutathione is especially made for cancer patients. Pero meron tayo pinatawag kasi ng mga serendipity.
But glutathione is not a drug.
It's actually a dietary supplement.
It's a nutritional supplement.
It's supplement. So, basically, ano lang to, antioxidant. Antioxidant.
Okay.
Just so happen na later on, they found out na the adverse effect of the glutathione is whitening. Kaya minahal siya ng mga Pilipino.
Where do they, I think only in the Philippines, that when I surf in the internet, let's say, even in the brochures of those IV glutathione, that there's no such a thing as skin whitening. So tells about antioxidants.
Yeah,
Yes.
it's actually being promoted as antioxidant
Okay.
to promote the wellness, to boost the immune system.
Do you have any idea who was the founder of the not really the manufacturer, but rather the founder here in the Philippines, where they use glutathione not as an antioxidant? Nangyayari kasi parang secondary na lang yung antioxidant effect really, no? But primarily nagiging parang skin, I could say not skin whitening, but rather skin lightener, no?
Yun kasi ang nagiging trend ngayon, ano? Dahil yung mga misinformed patients.
Okay.
But me myself, in my practice, I always make sure that ini-explain ko sa kanila na primarily ang ginagawa natin dito is to give antioxidant para madagdagan yung mga pangangailangan ng katawan. Kasi as we age kasi, lahat halos na katawan natin is starting to deplete. So that's the reason why nagkakaroon tayo ng replacement or supplementation.
Correct.
Kaya lang minsan kasi pinapansin nila na mga usap-usapan na ganito ang nagiging problema, ganito. Sinasabi ko nga sa kanila na even the best thing on earth could kill.
Of course.
Depending on how are you going to use it.
There you
Kasi
go.
napakarami kasi na like in vitamins, vitamin A, B, C. Lahat kasi yan, pag tinake mo ng sobra-sobra, makakamatay talaga.
Correct.
Yung dinidiscuss nila like Steven Johnson syndrome, even paracetamol, simple antibiotics could cause Steven Johnson syndrome.
Wow.
So, minsan kasi mas nililito natin or nakukonfuse natin yung mga tao. Sa halip na i-educate natin ng maayos para malaman nila kung ano ba talaga.
Okay. Wow, that's a good idea. But we have a texter from 0916-452-4088. Good morning, Doc. Ask ko lang, bakit yung PECAS ko, pag wala na, may ina-apply, bumabakat ulit. So, that means parang nagkakaroon recurrent probably yung PECAS. Probably it's just probably of those, Dr.
So
Fulgado.
yung siguro nangyayari doon, nagla-lighten lang yung PECAS. Nandun pa rin siya pero hindi niya napapansin dahil doon sa ginagamit niya mga product. So nagla-light lang yon. Kaya dapat talaga ma-address natin using yung mga intense pulse light, yung mga yan. Maganda kasi yung combination ng product.
We call it IPL. It's very popular right now. Do you have that kind of machine, Dr. Fulgado?
Yeah, we do. We have
what does it do? What does it do other than hair removal?
Hair removal. Ang ginagawa ng IPL is they break the melanin, yung sa melanin pigments.
Okay.
Kaya nawawala.
So you mean that it also remove the pigmentation of the patient using IPL without any surgery?
Without any, it's a non-surgical.
How long is the
procedure.
treatment then?
Maybe roughly about mga 20 to 30 minutes.
Oh, wow, that's not bad.
Even less.
We call it lunchtime treatment.
Lunchtime
So you
treatment.
can go to the clinic during lunch break, ha?
Gusto ko lang balikan, Dr. Cenica, yung tinatanong ng isang pasyente regarding dun sa bumabalik yung PECAS niya o yung melasma. Kahit kasi totally eradicated na siya or totally eliminated yung PECAS or yung melasma, mataas talaga yung probability na babalik. Kasi kaya ka nagkakaroon ng melasma, ibig sabihin prone talaga yung skin mo to have that kind of problem. So ibig sabihin, hindi ibig sabihin na kapag natanggal na siya by using any medications or kung ano mang ginamit niya, tapos na yon. Ang ibig sabihin lang nun na ang gustong ipakita nun na prone na talaga siyang magka-problema ng ganun sa skin. So dapat iniingatan niya, may maintenance dapat yan. At saka yung iwas sa sun exposure by using the sunscreen.
Now, regarding pampaputi, there's a question from 0922-945-6121. Pwede po bang uminom ng pampaputi ang may high blood? I don't know what's when you say pampaputi, kung ano man yun. Let's say, if and only if, let's say, glutathione. Pwede bang uminom ng glutathione ng isang may hypertension?
Yeah, it's actually not contraindicated with hypertension. Sabi nga natin, supplement lang siya. It's a nutritional supplement.
Another texter from 0922-704-4866. Good morning. Tanong ko lang po kung anong lunas sa pimples. Ano po ba ang dahilan at nagkaka-pimples ang isang pasyente? Dr. Fulgado.
Siyempre, pimples, yun yung mga impurities kasi sa surroundings na marami na mga dust, it can cause pimples. Lalo na yung pati yung mga stress, most common din na dahilan bakit nagkaka-pimples. So dapat alam natin paano
Some proper hygiene din siguro.
Hygiene, yes.
Ito, another texter from 0917-529-1117. Hi, good morning. I have a problem in varicose. Paano matatanggal ang varicose vein? Dr. Dalisay?
Before, what we do is the vein stripping, pero meron
Surgery.
surgery.
That's a surgery.
Ngayon kasi medyo nakakalimutan siya ng tao dahil because of the advent of sclerotherapy.